Thank you so much for being here. It's 8:30 in the morning, so that's commitment, and yeah, we appreciate that. I know it's early, so thank you for being here. How's everyone feeling?
Great.
Great.
Day two.
All right, day two. Yeah, that's the energy. I feel the same way. My name is Eric Siegel, and my colleague is with me, and best buddy.
Hi, my name is Andres. Good morning to everybody.
Yeah, we're super grateful you're here. I'm actually from North Carolina. I grew up here. I was born in Portland, Oregon, but grew up in North Carolina. And then I left the U.S. in 2012 for Peace Corps in Honduras, and then I did Peace Corps response in Colombia, in Barranquilla, and I guess I'm starting with the intro now. Yeah, I'm introducing myself. And then I was on a Rotary Global Grant Scholarship. I believe I was introduced to you, Ryan, on the way out for my Global Grant Scholarship, or maybe coming back in. I was in Oceania for 3-4 years in Fiji, and interned with UNICEF Pacific out there. While doing my master thesis, examining gaps between policy and behavior practices in schools in Fiji. And yeah, so WASH is central to my life. And in 2018, came back to the Americas in Bogota with Akvo, the organization I'm with now. And that's where I met Andres. And yeah, moved to Costa Rica in 2021. And that's where I'm based now. And we've been working, since moving to Costa Rica, we've been working on enhancing service delivery by way of partnering with USAID and global communities in Guatemala. And this is a program we're going to be talking about with empowering municipal level service providers with strengthening data processes. And then in 2022, we started working with UNICEF Colombia in La Guajira to build a sanitation portal. So really understanding the data processes going on nationally, and building indicators with one implementing partner and UNICEF Colombia, which we'll tell you about, to construct the data portal. So again, much gratitude for being here, and I will let Andres introduce himself as well before we jump in.
Thanks, Eric. So yeah, my name is Andres. I'm from Colombia. I am not coming from a WASH background academically, but life and the universe took me here, so we're all sitting here for a reason, you know. Have you ever wondered why you're working with water or with local communities or whatever research you're doing? We're all here together, and it's very inspiring to be here. I've learned a lot next to Eric, and I've been introduced to some great tools like the JMP, which I had the lovely opportunity to meet some people that directly work with JMP yesterday. So, you know, I'm following the suit of Aaron, you know, gratitude to our ancestors, you know, the people that were originally here in this territory, and to us as well for taking the torch. So thank you for being here, and I'll let Eric start the presentation.
All right. So yeah, we're going to start in Guatemala. Integrating WASH Services in Guatemala is the name of the program. It's a 5-year program, started in 2022, we'll go to 2027. And as mentioned before, the focus is on the municipal level in strengthening the WASH and WRM service providers in their continuous generation and use of data for decision making. USAID program, Global Communities is the implementing partner. We are in charge of the data aspect of the partners. So we'll be given the full panorama here in a minute. So, but just to calibrate regarding the goal and the theory of change of the program. So there's a pretty dire situation in Guatemala, humbly say that, but it's, we'll go to the problem after talking about the goal, I guess. But we're looking to improve the health outcomes in Huehuetenango and Quiché. We're working with 18 municipalities to expand a systemic intervention focused on rural indigenous communities and trying to expand programming to always include women and youth in the decision-making spaces. So the theory of change that's broken up into 4 outcomes eventually, but the theory of change is that by improving governance, professionalizing WASH and WRM services, ensuring that equitable access and involving the private sector, that the WASH program will expand and sustain change for better outcomes in the targeted communities in these 18 municipalities. I mentioned that the problem is dire. About 50% of Guatemalan children are affected by chronic malnutrition and stunting. This is particularly prevalent in rural areas where indigenous populations live. There's inequities in access to water, to safely managed water, and that's what the program is designed to affect. So again, talking about the situation in Guatemala, many people that interact with the Joint Monitoring Program may be familiar with this annual rate of change. So we we went at the beginning of the program, looked at the progress on the drinking water coverage towards 2030, universal access in Guatemala. And you can see that there's been, for safely managed, that's for the JMP people here, that's free of chemical and bacteria contamination, access to safely managed wash from an improved source on premise. So that would be safely managed. You can see that there's been an increase, but in order to achieve 100% by 2030, we would need a 10x multiplier. So that's a big change. So that's why that kind of sets the premise of like why this program was designed. So at least basic coverage, and the difference between safely managed and basic has to do with access. That there's safe water accessible for some of the time, that would be basic, and that still needs a 2x increase by 2030 in order to get there. So that's the program. And want to zoom in on rural Guatemala, you can see, so 10x in general is needed, but in rural areas where indigenous populations live there's 18x that's required. So urban as well. The program's not so much focused on urban areas, but 7x is required too. So a bit of the numbers, but let's get into the to kind of paint the picture of where the intervention is in Huehuetenango and Quiché, and then dive into to the progress that we've had for the first 2 years. So let's just focus on orange and blue right now. Orange is Huehuetenango, out more west, and then Quiché is in blue right here. So this is where the 18 municipalities are. The different colors indicate which implementing partners are responsible for the specific area, and we'll talk about that in a little bit, but just wanted to show you where in Guatemala that we are working. And the program is broken up into 4 objectives. Been talking about this yesterday. These areas were pretty present in most of the programs, so cool to see that we're aligned. USAID program. Objective 1 is we're looking at increasing accountability. We're looking at governance, right? Trying to influence transparency, inclusivity of women and youth in decision-making processes. So focusing on governance. Where we are as the data partner, we're positioned in Objective 2, increasing professionalization and capacity of WASH and WRM services. Building technical capacity at the municipal level. That's where the increased professionalization is focused. Objective 3 is improved WRM and increased service quality among the full service ladders. So yeah, looking at sustainable, equitable management of WRM and community health and development. And then objective 4 is where we involve the private sector and looking at influencing the market to foster like a business climate around creating WASH and WRM economies. So all of this is moving forward in parallel. These are the 4 objectives. And the way that we do it is through four different teams. So we've got a WASH governance team that's, supporting local capacity and at the national capacity, trying to improve accountability by way of, advocating for transparent governance. We've got the service delivery team. That's where we work, enhancing professionalization, really focused on capacity building to the service providers, understanding data processes, identifying gaps where things could be improved, and then designing an intervention, a data strategy to improve services. We have a social inclusion team that's also involved in all 4 objectives, ensuring that marginalized groups are included in decision-making spaces. And then the private sector and financial partnerships team, again, trying to create WASH and WRM economies. All right, pretty clear so far what we're doing? All right, thank you. So Akvo's role, to be clear, as well as, the data partner. A data strategy is focused on the processes, the technology, and capacity. So we've developed a data strategy for the municipal level service providers, WASH and WRM, to enhance the data capacities, really, in short, and digital and data capacity. That's our role, and that's cross-cutting through all 4 objectives. And we're just starting year 3 here in we're in October. We started in September, year 3 of the program, and so year 1 was very participatory. A lot of interviews with the actors involved in the data ecosystem, which Andres will describe in a minute. But the way that we're flowing through the 5 years is that year 1 and into year 2 was what we call a data workflow analysis and redesign. Brought us into, we did an impact model and a data ecosystem assessment looking at the community level WASH and WRM service providers, the regional level, Mancomunidades is who we worked with at the regional level, and then at the national level, understanding the data workflow. And then year 2, we kicked off with capacity building after identifying the gaps, designing the intervention for a data strategy, started capacity building of the WASH stakeholders. And then in year 3, what we're doing is implementing an improved data strategy. Andres will also talk about this a little bit. And this year, sustainability was built into the design, but this year we're really we see year 5 on the horizon, year 3, so really focusing on sustainability already in the improved data workflow. I just went over this year 1 and year 2, so we're starting year 3. And Andres is going to explain what looks like a pretty complicated model. This is basically to show the impact, how the interactions between the WASH and WRM service providers, and Andres will explain this, and we'll pull out the main data actors in the next slide, so please don't get intimidated. You probably can't see all the small print too, so a better explanation's coming from Mr. Andres Winograd.
Gracias. Thank you, Eric. So, maybe by a show of hands, how many here work with data on their day-to-day tasks? I think nowadays most of us do. Developing a data strategy is all about who's going to be using the data. So the first thing we did was we did an actor mapping. As Eric mentioned, it's an impact model focused in the center. There's the community, and surrounding the community in the rectangle boxes is the actual water system. And surrounding the community is the rest of the actors within the ecosystem that we were mapping. The circles are the actors, and we labeled them or color-coded them according to the level of their involvement. So starting in dark blue, we have the national level actors, followed by purple, it's the municipal level actors, and then finally in green is the community level actors. We can see here some, they're supposed to be yellow, they look a little orange, but those are the implementing partners that we're working with. And at first, when we originally mapped them, you can see them, they're right next to us, but a little bit isolated from the whole circuitry or network. Because at the time, we only knew that we were supposed to build their capacity, but we weren't quite sure or certain about their direct involvement in service provision. So that's become a bit clear now that we're implementing, but just so you understand the context of why they're a bit isolated here on the site. And as Eric mentioned, what we wanted to see, just by us interviewing, understanding, doing some literature review, try to understand what are the interactions between different actors, so that we understand what data they need. For example, at the point of the water system, like who is managing it, who is in charge of maintenance, who is in charge of water quality testing, who is in charge of monitoring the flow at the source, etc. So that's what we're trying to do, to get a better picture of what data flows and what data needs the actors would have. So this is another way of showing the actors. We have the national level, regional level, municipal, and community level. We mapped as many actors as we could, but just to elaborate a little bit on some of them, we have the Ministry of Health and Social Assistance. They are the national governing body for water quality. They are the ones that set the regulations for the parameters that need to be tested, the frequencies, and the limits. And they are also in charge of sort of supervising that water quality is according to the standards. Then at the regional level, we have the implementing partners. They are either one of two types. One is the mancomunidades, and for the colleagues here that have worked in Central America, you've heard of mancomunidades. They are basically a group of municipalities that are centered usually around water basins or some body of water. And we also have Agua del Pueblo. Agua del Pueblo is a local NGO. They are not a mancomunidad, but for this specific program, they are serving as an implementing partner because of the work they do with water and sanitation at the community level. At the municipal level, we have the OMASes, also maybe a familiar term for colleagues that work in Latin America. They are the municipal water and sanitation offices. There's also an upper level for the OMAS, which is the DIMAS. There are directorates of water and sanitation, and legally they have a bit more autonomy than the OMASes, but it takes some structure and time to get there. We also have the OFMs, or Oficinas Forestales Municipales, municipal forestry offices. They are in charge of water resource management and everything that has to do with land, water, soil use, timber, etc. And at the community level, we have the water committees, or CAPs, and also some development council that is also present in the municipal, departmental, and national level. This is the data ecosystem, and don't try to read anything that's in there so far. I think that the main bullet point of this slide is to show you that in any given country or in any given sector, there's a lot of actors involved, regulatory actors, supervisory actors, and there's a lot of connections going on between the different actors. We just wanted to map them out, and just for a little description, we have the same level, we have dark blue, we have national level, we have in purple, we have the municipal, and in green we have the community level actors. Up above we have natural resources. Here is water and water quality. This is the development councils that are in charge of, it's more like project management and budget allocation, as well as the municipal, this is more like the public sector actors, also in charge of budgeting and planning and resource funneling. So this was a next step. After we did the impact model, we mapped the data ecosystem as far as the literature and the interviews permitted. This is still a work in progress, so this is something that is constantly changing as we go through implementation. And this is sort of like the glue to everything we've been discussing so far, which is trying to understand like the key roles and responsibilities at each level. So for the national level, as I mentioned before, the role is more in terms of policy making and supervision. At the regional level, it's more implementation, the technical support work and assistance. At the municipal level, we have regulation, ensuring that the standards and the norms are being met. Also project execution and administration. And finally, at the community level, we have more the operational management, maintenance, and the day-to-day tasks. Hand it back to Eric.
Absolutely.
Yeah.
That laser pointer is pretty cool.
Yeah.
Which one's the red?
The red one, yeah.
All right. Yeah. So yeah, thank you, Andres, for showing. Yeah, I think the main data actors is important, and our data strategy is focused first on the regional and municipal level. So every day we're interacting with the mancomunidades, which are Mancomunidad Frontera Norte and Manorc right here, Norte Quiché. Agua de Pueblo is actually an NGO, but they function like a regional government because of their history in the region. They've got the connections with the municipalities. So I'm gonna talk about the municipal level though, because this is our real target audience. The data strategy that we've developed is we do training of trainers with the regional level, and then they replicate the trainings, and we provide technical support in the implementation of the data strategy at the municipal level, particularly with the OMAs and DIMAs and the forestry offices. So I'll go back to that slide that we were just on, and that's the main municipal WASH and WRM entities are the OMAs and the OFMs that we're looking at. So main difference is OMAs responsible for the WASH services and the OFMs responsible for WRM. And during that first year, the evaluation that we helped to carry out, we saw a definite need in capacity building for generating data, analyzing it, and using it for decision making. So that's what we designed the data strategy around. And I just alluded to a little bit of what year one was about, the assessment and planning. So the rollout of the data strategy was talking about phases. Assessment and planning, that's year one into year two a little bit. The pilot of the data strategy, started to test a couple of the sessions, which Andres will elaborate on the sessions here in a moment. But piloting the implementation, the data strategy is iterative in its design, continuously getting better. It's designed to incorporate feedback. We started with the pilot for OMAs in December of 2023, and then we said, okay, this is working in 8 of the OMAs, and let's scale and integrate the lessons learned into phase 3. And phase 4 is also iterative, continuous monitoring, optimization of what we're doing. So that's the phases that we're going through. And Andres will explain the data infrastructure, which is really one of the key parts to, remember I said data strategy, processes, tools, and capacity. So the processes and tools are really the structure of the data infrastructure, and that sets the foundation for building the capacity to sustain the data infrastructure.
Thank you. So again, another diagram. We love diagrams. They help us organize our thoughts, and sometimes they look scattered, and when you do a diagram, everything starts to make sense. So this is the diagram for the data infrastructure. There's 4 different compartments. There's data collection, data management and processing, there's data analysis and decision making, and then there's storage, which kind of falls underneath all of them. What we had to evaluate was, okay, what is our audience capable of managing, what makes sense to them, what do they already use. We don't want to get there with new tools. If they already use Excel, we want to stick to that. So we also want to try to get them to bump up their level. So with digitalization, but at the same time, we don't want to push too hard, because if things start to be confusing, then we don't get them to adopt the new processes, and it won't make sense. So the first thing we need is to get them to generate data. So whatever gets them there is what we establish. So in the data collection side, we established 3 alternatives. One is the physical forms, is nothing further from what they already do, taking notes physically on paper. The second option, the options we introduced or newly introduced for some, were Kobo Collect for collecting data, and Google Sheets for just direct digitalization of data. Both of those, even with the physical forms, eventually they had to digitize. That was the step we were going for. With Kobo, the data goes in through the web or a mobile app into Kobo Toolbox, which is the data administration platform. In there you can access your data, you can make edits, you can erase entries, etc. You can check for data quality. So that's sort of where you manage and process. You can also manage and process within Google Drive if you upload a Google Sheets document in there, or if you take your data from from Kobo Toolbox, you download it as XLS, CSV, or JSON. You can get that spreadsheet and also upload it to Google Drive. In the data analysis and decision making, we kept it simple with Google Sheets, Excel, Word, and Google Docs, just to make sure that they could capture their data, create tables, and create reports. And not in the end, because it's a cyclical process, there's no end, but these reports would get stored in Google Drive, which is a cloud-based service. It's free. The base entry tier is 10 gigabytes. If you're collecting, even if you're collecting 2 water quality samples a day for 100 systems for 10 years, you're not gonna fill up 10 gigabytes of space. So as long as we start keeping it simple, at least we're introducing them to a tool that could help them. And we're already getting organizations that are saying, hey, we're considering paying the paid service for Google Drive, for cloud storage, 100 gigabytes, and start adopting this tool not only for water quality and data processes, but for other organizational things. So it's definitely a step up or forward. So yeah, this is the data infrastructure.
And we'll show a little bit of the actual data that's being collected to date in a slide in a minute. And this is the data infrastructure we're implementing, and then we're working every single day with the implementing partners on the sessions that Andres will go to right now on building the capacity to ensure that there is continuous data collection, the management and processing is the capacity is there to do it, and then the analysis and decision making. Thanks for explaining that, Andres.
Thank you. So, as Eric mentioned, it's very important to sustain this, and I was talking to a colleague before, to Gina actually, on coffee. If you don't get people to see the value of collecting data, they won't collect data. They will see it as a hassle, it's extra work. So really, what most people are looking for is a dashboard, a nice Power BI dashboard with all the information, nice graphs. But really, data is more than just a dashboard, right? It's, as Eric mentioned, it's the processes, the people, and the tools behind it. And really, what can you get out of it? Is it improving your day-to-day work? Is it helping you expand your service? Is it helping you improve what you're doing? So getting there is tough, but eventually, if you put the effort, you'll get there. And this is the stepwise process to get to that step where you actually see the value of your data. So we divided the process in sessions, 7 sessions. which are like encompassed in 2 phases. So phase 1 goes from session 1 to session 4. This session is focused on introducing the data strategy, making sure that the organizations understand the value, they plan to collect their data, they know what they're getting and why they're getting it. And this phase, the end product of this phase was creating and generating a water quality report, which actually by mandate, the OMASes are supposed to submit a water quality report to the Ministry of Health every month. So when we picked this process up, I think it was 2 OMASes that were fulfilling that requirement, and now we have somewhere around 13 out of the 18 that are already generating their own water quality reports and submitting to the Ministry of Health. So that was phase 1. So as you can see, the completion on the left, it says 50% until session 4. This is so you can understand the graphs we're going to show in a second. And phase 2 goes from session 5 to session 7. The end result of this second phase was to actually create wash plans. And the additional surveys that were used to create, or that will be used to create these wash plans, are communities and systems inventories. So that gets us to 100% of our implementation. This is the current status of our implementing partners, and the OMASes in red, the red line, you'll see the baseline where they started, and the blue bar is where we're at right now. These graphs are also anonymized. This is implementing partner 1, implementing partner 2.
This is after 2 years of implementation.
After 2 years.
Yeah. So yeah, there's 3 implementing partners as we talked about. So yeah, the first one is in charge of 5 OMAs. This second one has 3. And you can see the baseline was some reported that they had higher capacity at the beginning, but then what we actually found out, the capacity wasn't there. So you can see the progress, baseline versus current.
And that's also a good point that Eric is raising, because one of the, like, what we see in this type of organizations that suffer when there are changes in government is the transfer of knowledge. So when the government changes, sometimes we lose the information. We lose historical data, we lose processes, we lose skills, because also the people change. There's a high turnover rate. So part of what Eric was mentioning, there's some OMASes that were reporting a very high level of capacity, but when we got there, the roles were changed, people changed, so actually that was not sustained. So part of the reason of working through implementing partners is to ensure that we are not that affected with turnover rates when the political parties change. So yeah, I think you're all wondering, or if you're not wondering, now you'll wonder about what is actually in the databases that we have started compiling. We'll show you a very brief snapshot right now of what is there. And yeah, just want to mention that this is something that the OMASes, municipal level actors, have picked up. This is data that they have generated. This is not data that us as the consultants or the implementing partners have gone and collected. This is actually the OMASes have started collecting this data. So far in the databases, we have 162 communities, 186 systems, serving 45,000 households, 218,000 people, and we have collected, or the OMASes have collected rather, 2,400 water quality tests so far. Just to be clear, these databases are comprised of both primary and secondary data. We have used the databases of the Ministry of Health, Agua, now Cibasa, also supported by the OMASes updating the information and registering key data, just to ensure data quality, which is another big aspect that we're working on right now. And also here, this is a dashboard we recently created for them. It's automated, so all the databases are on the same Excel sheet, and this dashboard draws information from all the databases. It's in Excel, and you might recognize these categories or indicators also from the JMP: accessibility, continuity, affordability, and availability. These are the key indicators that we have introduced so that they can create wash plans and take decisions from the data they are collecting.
Each of the OMAs has and maintains these databases that has this information. So as Andres mentioned, started with community inventories. An inventory, I think Megan was talking yesterday about how one municipal service provider can be in charge of like 100 communities. So many of the OMAs did not have an inventory of the communities they're responsible for and the water systems that are within those communities. So that was step one within the sessions Andres was talking about. And then, yeah, the water quality information is also in there amongst the other JMP indicators. We have the social inclusion indicators as well. We've got a gender specialist on our team that, yeah, ensured that that the indicators, took into consideration social inclusion. So we have, if a community is particularly an indigenous population, if women are involved in the decision-making processes, all of the OMAs are maintaining these databases now. So that's after 2 years, and looking to go to year 3. And I think this brings us to the activity, yeah?
Yeah.
So everyone's probably ready. It's around 9 o'clock now, I imagine, to stand up. And I think Andres is gonna lead the activity, or if there's, I don't know what's the next slide. I'm getting ahead of myself. I'm excited.
No worries.
I do that.
Eric wants to start the activity, so
Alright.
we'll go ahead and start the activity. So if everybody can stand up, we can take a little break from sitting down, maybe stretch a little bit, breathe.
And while you're up, are there any questions? Any questions so far? Are we ready for an activity? Activity time. All
Let's
right.
do it. We have the testimony that we want.
We have
Aye.
testimonies too. I wasn't ahead of myself.
Yeah.
One of the objectives there, you have objectives on your slide there.
Objectives.
On your slide.
That was back
Yeah.
towards the beginning.
Yeah.
Yes. Should we go? Okay. Yeah, the objectives?
Yeah, number 2, how did you implement that in your work? Number 2 objective,
The
how
pro-
did you implement it in your work?
Objective 2, the
The
professionalization.
professionalization, that's the capacity building component. That's, we're working with the OMAs, the municipal level service providers in the data strategy. So professionalizing is capacity building to collect and use data for decision making. So yeah, I think in short, that's the professionalization
I
process.
have a question. How long did it take to train the OMAs?
I mean,
We're still training them.
we're still
Oh,
trying.
you're still
Yeah.
training?
Yeah,
Okay.
and some have, and I want to make sure I answered your question too, but it's an ongoing process. And some have advanced further than others, and that was the graphs of how many have gone 50%, and some are lower than that. And
Yeah, maybe let's
let's do the questions after.
Yeah, let's try to-
So, and we'll
go back to that
we'll
one.
get back to that after. Or did I answer your question, professionalization? Okay, cool. And we'll do more questions after. So yeah, everyone's standing
Cool.
up now.
Yeah.
So in
Yeah.
essence, you are saying that the work is still ongoing.
Yeah.
Absolutely,
It's
yeah.
just part of it that you're giving us here now.
Yeah, yeah,
It's a 5-year program.
It's,
we're 2 years in, yeah.
Yeah. So yeah, this is just we're piloting some Power BI dashboards that look pretty, just to get there. But there is a sustainability aspect, because you need to pay for the licenses, and sometimes that's not feasible for municipal level organizations. Although, as I mentioned, governments still manage a lot of budget at the municipal level. So as long as you make them see the value and they actually use it, it becomes feasible. But if we're just gonna have this pretty dashboard and no one's gonna update it or use it, then it doesn't serve a purpose at the end. So yeah, our colleague Pedro, he's watching, probably. He is in Guatemala, so shout out to Pedro for creating this dashboard and
Yeah.
lots of other stuff that he's supported us doing. So now, yeah, we have a couple of testimonies, but maybe we can jump to those at the end after the activity. Anyways, you'll get a copy of the presentation where you can see these are some photos of the capacity building workshops in Guatemala, working with the coordinators of the implementing partners, mapping systems and getting them to actually present their information, their data plans.
Let's do the activity, yeah. I think I might have hit the slide or something. Do you have the activity slide?
We hit it.
Okay, but you know it.
I know it.
All right.
Yeah. More pictures. Okay, so we're gonna, yeah. Most of you raised your hands. You said you work with data, so we would love to get your input. Even, if you haven't worked in Guatemala, we would love to enrich our data strategy and data infrastructure and, take your perspective. So we're hiring you for a short period of time. We have free coffee outside for you guys. So basically what we want to do is we have some sticky notes and we want to get you to put on the different, in the whiteboard, you'll see there's organizations and stakeholders, critical data, community voices, and capacity gaps. So we'll have the blue sticky note for organization and stakeholders, the yellow one for critical data, the pink one for community, and the green one for capacity gaps. We just want you to write down, okay, which organizations should be taken into consideration when you're planning a data strategy or when you're planning a data intervention. Like, who should you take into consideration? Maybe it's the National Department of Statistics, maybe it's, community leaders, whatever you can think of. Same for critical data is like, what are the critical data points where you work with water, sanitation, hygiene in your area of expertise? Like, what are really the critical data points? Maybe it's the water flow, maybe it's the amount of rain, maybe it's the temperature, maybe it's the pH, whatever you can think of critical data points, maybe it's something completely different. Same for community voices, like who should we listen to? Like, who needs to give input when we're developing a data strategy? And finally, capacity gaps. Like, where do you think, or in your experience, where are the largest or the most critical capacity gaps? So, if you want, yeah, you guys can come. We have only 10 pens. I didn't know we were gonna be this many. So, if you want to come forward.
What about groups, Andy? Could we get people in groups of four?
Yeah, you can get them in groups of 4.
Can you please get in groups of 4? and then we'll
maybe you 4 by exactly.
And I'm gonna unhide this slide.
Eso, good idea. So you'll do organizations and stakeholders.
There, 1, 2, 3, 4.
You guys will do your
Very good.
first here, or maybe you 3. You guys. Yeah. 4, 1, 2, 3.
Otro Andres, I did not understand.
Huh?
Again,
It's
Okay.
up here.
You will think of.
I understood when there were not 4 people, now there are 4 people. What do we do?
You focus just on one of the sections.
Okay.
So you guys will do critical data points.
Ah.
Do it just to
Oh, I understand. I'm so jet lagged.
Oh, no worries. Where did you find it?
right now.
Reading voices.
When you're close to it,
The groups do not matter.
we can put something.
That's why I don't understand. I'm so jet lagged, I'm so asleep.
Yeah. These are
We will concentrate on one, on just one.
Yeah, I think we should take that for
Who is going to be the?
Water quality.
You will do. Can you
community
just use that?
Yeah, sure.
And you will do organization and stakeholder.
Organization and stakeholders.
Write down any organization and stakeholder that you think should be taken into consideration.
Given that we are
When we
from
plan
different countries, perhaps just write down the organization or country.
We're yellow. We're supposed to do data representative. You said community voices.
In my country,
That's fine. That's fine.
think of anything, it will be there.
Yeah. Or community engagement.
Department of Health, Department of Environment.
At the community level.
All right, and we'll do. Yeah, you have 5 minutes. And I've put the color references
Yeah,
on the
I think I
chart.
messed it up. I
It's
gave
okay.
them another reference.
What's that?
I gave other
Okay.
capacity gaps. I worked.
You told us critical data.
Yeah,
You gave us pay.
yeah. Go with critical data.
Okay,
Yeah, don't show it.
Don't show it?
Yeah.
You mind if I just?
I didn't show it, but I set another color because I didn't have that up.
Or you want to switch it real quick? Go ahead and make the change.
For the people watching online, we got this.
Like your comments, yes, we don't have like.
No, I know, I meant like, have what? Sticky note.
There's a department, they're working with the NGO in Nicaragua, and there are like the exact information, so the department, I'm guessing that's the government.
It's 9:17.
Survey.
So yeah, we should finish in 5 minutes. I never asked where you Okay.
Very specific. I remember reading paper with stuff.
Women's groups, in terms of other members, churches, civil society.
Can you just like a get a decent
Is
leader, like a volunteer?
you're from here. How is it in the US takes care of water?
And once you've got it down, please feel free to go put it up on the board.
Which level?
I think
Absolutely. Yeah.
Because
Usually the local community don't have water out there.
whatever that is city, municipal, provincial.
It's usually the ones
I suggest a method. Okay, so now we have who. Or is there anyone else want to add?
Take into consideration.
Department of Finance. Which projects are more meaningful in assessing water?
Yeah, it's not.
Yeah, I'm a student here. Because they
2 minutes. 2 minutes, guys. Please start going and putting the sticky notes up on the board.
They have like although they the budget comes from certain create that. And sometimes there's like the national government gives a budget, but it's not enough for what the local government is thinking of.
It's always like that.
It's always like that.
Government that do sponsor it. But
Also,
And we'll be 25, yeah, that's the goal. To switch over to UNICEF.
what is meant for the
Yeah.
That's
How it is.
even in my country, we like construction projects because it gives them an opportunity to pocket some.
Sure. What about
Right. Oh, yeah.
Guys, one more minute. One more minute. We also want to get you to look at what other groups came up with. So as soon as you
In my country, there is a department of audio. They should be a stakeholder, so
Where the water board
they can
itself
watch.
talk about what's
They can save
that's where the water authority, the national water authority, has someone that will engage which you have to be a social science person.
Maybe they were also assigned. Yeah, they were also assigned.
Yeah, so with approach, trying to do it like informally, so the guy here.
Same assignment.
We are a startup together. We design. It's just started with training, but there is no like a regional profile to a secondary government site. But it's usually someone that on site is friendly for people with disability and not a big authority. So call for a meeting. So I we're a very small startup. So we're just trying to like find out what you are thinking.
Alright, we got some organizations, we got some critical data points.
Isolated communities.
Creating a
Very.
Right. Sure, interesting.
So right now when you're doing the presentation,
Yes.
okay guys, if we could gather back, please, and can we get one person per group to stand up here, please? Hi guys, let's start gathering back. If you haven't pasted your sticky notes yet, please come up and do. And we'll get one person per group just to stand in the front and we'll do a little sharing. So
What are you doing in school?
the group in the back.
Where do you want us to stand?
You're gonna share?
Yes. Eric was before Eric.
I want to go to all this water policy.
He was yeah. These guys, taught me so much. Morning yourself. I'm a morning guy. Okay.
It's so different.
We'll do happy. And they can all hear.
I guess. All right.
All right, so we're presenting now.
Yeah, just briefly, so we have the second part of the presentation. We're gonna talk about the program with UNICEF. So just briefly, if you could talk about maybe some things you came up with that perhaps were not mentioned in our presentation and why you think it's important to include them, please. So let's start with organization and stakeholders.
Okay, for our group, it's mostly government ministries that are here. But we also named civil society and community organizations. I think also very important. But it's mostly Department of Health, Department of Statistics, Department of Water and Sanitation, Department of Public Works. So that's it. Those are national and on the local level.
Great. Thank you, Gina, and the group with the blue. That's, yeah, I think that echoes what we had with the main data actors, with the national, regional, and community level. And then, yes, CSOs always play a part, the government entities, and did you say anything else? CSOs, government entities?
Ministries.
And ministries.
Local organizations also.
All right, it's good to clap in the morning. Thank you, Regina. All right, for critical data, what did we have?
So some of these were mentioned, but we had a number of households with improved sanitation, improved hand washing, number of days with no flow, and also water volume, like for metering, water quality indicators, some standard household data, and some social data like gender, income levels, disability, making sure like all populations are reached, satisfaction levels and payment for water, also water storage capacity, and we also had number of days of diarrhea, just like indicating, you know, the statistic that you shared that approximately 50% of children, you know, face like diarrheal diseases and other like contamination. So depending on what you're measuring, we had like a wide range of critical data points to consider. So yeah.
But covering water, sanitation, and hygiene, and water resource management, which you put. So great job to the pink.
And health indicators.
and
So
health
that's a way of articulating also with other, I mean, with the Ministry of Health, but articulating other indicators that, you know, can have a dialogue with what we're trying to affect. So, great.
All right, thank you, pink. All right, let's go to community voices, please, in yellow.
Awesome. I'm Wes with COBA, and we work in Nicaragua, Honduras, and El Salvador. So, yes,
Nice.
and Guatemala. So excited. So we had community voices. So we started off looking at who we should be talking with. So water board, we had like operator, plumber, president, treasurer, kind of understanding some of the financial components of the water system, or whoever's operating the water system. Women's groups, community leaders, community health volunteers. Then also kind of looking at the voice, the community voices, but from the Ministry of Health. And then the water authority, and then finally we kind of dove into like how, and through like some of their bi-monthly meetings, or the community meetups that they have.
Nice.
Yeah.
The how is a good detail to
Yeah.
include, yeah.
Yes.
Absolutely.
Great.
Thank you to the gold team.
Thank you.
All right, the capacity gaps, very important. So what do we have in green here?
Yes, my handwriting is really small, so I have to get closer. So the first one is literacy challenge. So with regards to more digital literacy. So obviously everyone knows the access to maybe Facebook or media platforms like that, but it's beyond that to use maybe the digital platforms that you're using. So there might be a challenge there. Missing data of the workers involved. So from a screening perspective, you know, do you have the data of who you've hired to you know, and do you know enough about them? Data visualization, so again back to convincing the people how important the data collection is, otherwise you're not going to have buy-in. The funding of the data collection, so obviously funding is always an issue, so is there a gap there? Resources, so have you enough resources in relation to workers, in relation to computers, in relation to internet access, so that could be a gap. And then possibly a gap in government involvement, so you know, if you provide the data to them, do they then have the policy to go further with that and implement?
Yeah, these gaps we definitely see and are dealing with, since the beginning, since the evaluation, also have seen these in Guatemala, and the digital capacity, the resources, and the turnover, very prevalent gaps in what we do. So Yeah, thank you for that. Thanks for the green tea.
We have green too, if you want.
Yeah,
You want me to
please,
add too?
yes,
Yeah.
please.
Yeah, so I mean, ours overlap a little bit. I mean, so gaps in one, identifying the kind of data that you need and then figuring out where to go get it. Two, the capacity to analyze, obviously. The technology, do you have the technology to both get and then to crunch the data you need? And then if there's transboundary data involved too, that I know that in between countries, data can be kept as sometimes a state secret. So thus, is there diplomacy that needs to be, diplomacy gaps that need to be filled too?
Yeah, watch data gets political all the time.
Very fast, yes.
Thank you guys so much for the participation.
Thank you.
So, yeah, we're going to go to Colombia now. So, Andres' home country. We also have another special Colombian in the building. So, thank you for this is the iWatch team after a football match, so very important as well. And yeah, let's go to Colombia now. So we were focusing on water, sanitation, and hygiene and WRM. So the whole spectrum in Guatemala, and then in Colombia we're zooming in on sanitation. So I think this is the Bible for sanitation, the state of the world sanitation. It gives an overarching and detailed view of the challenges that the sanitation crisis is. And without going into too much detail right now, I think we're all aware, yesterday people were talking about the health impacts, the economic costs, the slow progress towards achieving universal sanitation, access to sanitation by 2030. We're not on track, and that there's a call for action in the sector. So I think that sets the premise for where we're going to Colombia and digitally tracking sanitation solutions in Colombia. And Andres will start us off.
Thank you, Eric. So, very important to know the current state of the world's sanitation, to also understand and contextualize the situation in Colombia. Actually being here and hearing a lot of our colleagues makes you feel optimistic about the future and know that people are actually doing something to improve the conditions around the world. Still, there's a lot of work to do, but we'll get there if we continue at the same pace and the level of commitment. So, Colombia, my home country, the situation in Colombia is not easy in some regions. There's currently 1.3 million people that still practice open defecation in Colombia. And of course, the health impacts of this practice affect children under 5 the most in terms of morbidity and mortality. So it's something that is definitely one of the key focuses for UNICEF globally. But in Colombia, UNICEF has really set the tone in terms of eliminating open defecation by 2030. And the focus on La Guajira in particular, UNICEF has been really diligent in understanding which are the regions in Colombia that suffer the most from open defecation, and to understand the demographic conditions also prevalent in those regions. So La Guajira, I'll show a map afterwards, is located in the north of Colombia. It's a desert, so the water situation in La Guajira is very tough as well. It's close to the border with Venezuela. Lots of immigrant populations as well, lots of really displaced populations from the internal conflict in Colombia, mostly Wayu communities, which are the indigenous communities that live up in the north. So this is the sanitation progress of Colombia since the 2000s. As you can see, Colombia has done a great job in closing the gap towards ending open defecation, and this is really why UNICEF has honed in to this specific target by 2030, because they are confident that it can be achieved. Eric mentioned the situation in Guatemala, the 18x needed to accelerate reaching at least basic sanitation or improved water service. But in Colombia, the step to get to, universal sanitation for all is first ending open defecation. So that's UNICEF's objective. The acceleration rate required to get there is 1.13x, quite low as compared to what was seen in Guatemala. And one of the key locations where this open defecation is prevalent in Colombia is La Guajira. So La Guajira is up there in the north, as I told you, and yeah, 43% of the population lives in rural areas with very limited sanitation infrastructure, and 48% of the population is indigenous, mostly Halü. So we can see the vulnerabilities, and we teamed up with UNICEF Colombia to develop a sanitation portal.
All right. Yeah. Thank you, Andres, for giving the context. Cool. Universal access to sanitation is almost there, but eliminating open defecation practices by 2030 is the first big step. So that's kind of the premise of having a sanitation portal. Is we wanted to identify the indicators that would allow us to say, okay, open defecation has been eliminated. So we used the Satoso methodology. This is a community-led total sanitation focused on hygiene and sustainability. CLTS is a methodology that UNICEF uses. Satoso, one that was developed in Guatemala, if I'm not mistaken, Guatemala, and then replicated in Colombia. It's very participatory in its essence, engages the community in some phases that are activation until certification of open defecation free. That's this ODF acronym. Manaure is the community within La Guajira that really suffers from preventable diseases that results in death, especially with children under 5. So UNICEF picked out this community, had an implementing partner on the ground in Manaure. So we wanted we'll continue to create a system that would allow us to track the sanitation needs, the solutions, what's working, what's not in terms of program progress, and then put together a portal that would allow real-time tracking of progress towards sanitation goals and specifically open defecation. So UNICEF, working with them, they wanted a couple of key features on the sanitation portal. So we've got georeference data that communicates exactly the sanitation needs, the community responses, and progress. It integrates health information. We've got national databases integrated with data that's coming in from the local level that the implementing partner is bringing in. And Andres will show in a minute the data portal that has this vulnerability indexes that show which communities have the most needs, and decision-making tools on the web portal. So here's just a tour of the web portal, and Andres will actually go to the web portal to explore it. But that's the premise. I think that it's important to mention that the way that we designed the portal was from a systems approach. Back to Guatemala, we talked about the data ecosystem assessment and the impact model. We implemented this systems approach as well for understanding how data flows between the various stakeholders. So in building this portal, we want to understand who is submitting what data, what types of data. I think that was, basically everything that the pink group put on critical data points, and the blue group over here with the organizations. We needed a map to understand the entire system to make sure that it was inclusive in terms of organizations and the data that's coming into the portal. And that's participatory in its essence. So Andres will explain, again, another map.
So another diagram to help us organize our thoughts. This is at the program level. So first we looked at Satoso program that Eric was talking about, we have to understand, do they work in phases? Do they have specific milestones? How do they track progress of the program? So that's more or less what we have here in the blue boxes. In green, we have the actors. We have us, Akvo. We had another data partner, IMAP. Fundación Halü is the implementing partner. UNICEF as the leading vision and funding. And Guatemala as the capacity building organization. And then we have the Satoso program, which has different phases. I think in total it's 11 phases. And with the stars, what we try to do is identify where we would have like data points or indicators that we could start mapping. So for example, at the different phases, we would monitor like certain indicators that would tell us how far the community is getting towards certification as ODF free. We would also have the certification itself. They wanted some cost efficiency indicators as well, but that was a bit tougher than expected, and that really depends on like how good the implementing partner is in tracking their costs, if they are reporting them, etc. And also some prioritization indicators, just to make sure we're tracking some demographic indicators at the community level. For example, if we're talking about sanitation and we're talking about acute respiratory diseases, then we know that we really need to understand what is the demographic in terms of the population of children under 5 that live in certain communities, and how many of those children live in a house without a sanitation solution. So those are some of the things we're trying to look at. And this is really at the, as I mentioned before, this is at the community level, at the program level. But we also took it a step further, a bit broader at the national level. So we were looking at different national databases to understand really like what is required to give the contextual information. So when you reach to the portal, maybe you don't want to see the community level information right away. You want to see what's the national situation in Colombia, what's the departmental and municipal situation in terms of access to sanitation services. So that's really what we wanted to map as well, national, regional, community level. What are the data flows required, from the program level? Who is supposed to update the information? What is the database that we're gonna take that data from, pull that data from? What's the frequency, etc. That were all things that we started thinking about during this process. And identifying the databases. So we gathered data from the National Department of Statistics, El DANE, in Colombia. They have really good databases. They have a census from 2018 is what we mainly used to collect the information or to pull the data to the national tab. And we also gathered some health indicators. And let me just tell you that it is really a challenge to mix and match health indicators and sanitation coverage indicators because of the level of granularity, mainly. So hospitals would gather health information at the person level, but the information you get for sanitation coverage is at the household level. So it's really difficult to compare. Also, the frequency at which the data is collected, the census is collected every 4 years in the best of cases, and health data comes at a weekly basis almost. So that's also something you need to consider, what's the frequency. And finally, the health information is registered at the point of care. So you will get the information from the hospital, and you don't get necessarily the information where the people are actually coming from. So those are some of the challenges that we have encountered, and that UNICEF has also shared with us that they have encountered when using the portal and updating it.
Yeah, sure. So results and impact, we spoke with UNICEF last week before coming here to get an update on how the portal is being used right now. So key achievements, just want to highlight that the portal is operational. You guys can visit the portal afterward. It's all in Spanish. But you can see the indicators that are on it at the national level, the program level, and at the community level. The certification progress for ODF communities are plotted on on the portal, and the vulnerability index as far as an advocacy tool is being used in conversations with the government, and there's intention in February of 2025 to begin scaling up more communities that will be reporting data onto the portal, and we have the names of the communities on there, I think, in the next slide. So yeah, expanding the Satoso methodology, this community-led total sanitation methodology in Chocó. Andres helped me with Arauca and Norte de Santander are the next communities in line to be onto the portal. So excited for you guys to explore it. And yeah, we're working with UNICEF to build capacity, first at UNICEF and then with the implementing partner to use the portal, and then to ensure that the streams are updated so that there's actually real-time data coming in. Right now it's static. It's data from, as Andres said, it's health data coming in that was at the moment of constructing the portal, and then we've got census data in there. So yeah, we want real-time data is the goal, and that for it to be used nationally.
Thank you, Eric. So now for the interactive bit, the portal, as Eric mentioned, is in Spanish, so we're not gonna get you to use it just yet. However, we will do a demonstration of a use case for the portal. And yeah, we'll try to have a conversation around like your experience using other sanitation portals or wash portals, and perhaps you could give us some feedback as to what is being presented, some ideas. So for now, the plan is just, I'll walk you through it. You can access it on your phone. Feel free to access it. This is the URL, satoso-colombia.akvo.org. We don't have a fancy QR code that you can easily click on, but it's not that difficult of a URL. And yeah, you can navigate on your phone or on your laptop, your tablet. Feel free to access it. For now, what we will do is just do a little walkthrough. So here, this is the landing page. You have the dashboard on one tab. You have another tab that has the user manual. So we created this user manual so people can see what are the different components, where is data coming from, and also some use cases. So we've walked people through in the user manual some of the potential uses for this dashboard. And again, what UNICEF asked us is they want a dashboard that helps you identify the sanitation needs in the country, and they also wanted a portal that enabled you to see the progress on program implementation. So in this case, we only have Satoso program, but so far, like if you're a program implementator and you wanna create a sanitation program in Colombia, so what's the first thing you wanna look at? Anyone wanna chip in? Like, what would you look at if you want to implement a sanitation program in Colombia to eliminate open defecation? What information would you want to see?
Sanitation coverage.
Sorry?
How many toilets there are?
How many toilets?
Sanitation coverage of different communities.
Sanitation coverage?
Coverage, yes.
First thing is to interact with them
Stakeholders?
first.
You want to see who you can
Interact with the community.
interact with the
and,
communities?
Get them to know the effect of open defecation
Great. So
Community
it's
voice.
before any other thing.
agreed.
Absolutely.
Yeah, it's really important that you make sure to get to the community. So how to evaluate what communities you want to talk to. So as someone already mentioned, the sanitation coverage.
Yeah.
So here in the portal, the first page is the national status. So you have the map of Colombia, you have the sanitation coverage information. This is actually basic service coverage up above, these gauges. You have the distribution by social strata, just to make sure you can disaggregate by some other social parameter. You have the type of sanitation solution, and this is aligned with the JMP, so basic or improved, not improved, and without service. Without service is the same as, you know, they don't have a sanitation solution. And we have the type of population. So the National Department of Statistics of Colombia is really good because they disaggregate the populations by, you know, the head of a department. So it's like the political capital of a department. If it's a populated center, so big cities, and then they have really dispersed population. And in a minute, I'll show you how this comes into play. But overarchingly, we're looking at this basic service coverage, and here we have sanitation coverage. So this is in households. So out of 13 million households in Colombia, we have 12.7 million that have sanitation coverage. And if you just hover here on top, you'll see what percentage that represents, so 94%. And here on the map, you have a different color. You have a color code. The darker the color, that means the more vulnerable the location is. So right from the start, you can see, hey, there's 3 regions that are really vulnerable, like Bichada, we have Baupés, and up here we have our use case, which is La Guajira. So you can already start to focus your implementation. Okay, I'm not going to focus in all Colombia. I know there's 13 million households. You know, that's not very feasible. So let's hone in to one region, which is La Guajira. So up here you can filter, and we can select La Guajira, and you'll see the rest of the dashboard will adapt to the situation in La Guajira. You see the coverage already started going down in La Guajira, the situation in La Guajira. So the sanitation coverage in Colombia was around 94%. We see that in La Guajira in general is 58% already. We see a difference there. We also can see there's a difference in the spread of the social strata. More people concentrated in the lower 1 and 2nd strata. The type of sanitation solution, you know, this is the summary. We have so without a service, we have 86,000 households without a service. And we also see the type of population changed. Most of it is either rurally dispersed or part of like the capital of the department. So if we want to hone in even more, here at the bottom we have the different the vulnerability by municipality. So this is already indexed through a vulnerability index that we designed. There is much work that we can still put into this vulnerability index, so if you guys want to have a conversation around that in the hallway with a coffee, we're more than happy to talk about it. So far what we included there was the proportion of the population that is really dispersed, because this is really a segment of the population that is marginalized and really suffers the consequences of access to sanitation services. And we have also included the proportion of the population that doesn't have a sanitation solution to determine the level of vulnerability. So you see we're already situated in La Guajira. We want to determine, okay, let's hone in even more. We have Manaure. Eric mentioned Manaure as one of the focal municipalities in La Guajira. So we'll go up here and we'll select the situation for Manaure. And just to show you, like if we click here, really dispersed, let's check out the situation for the really dispersed in La Guajira. So I'll click on that, and you see that the basic services go down even more. So you'll see that for a total population of 356,000 people, 87,000 households, the sanitation coverage is only 8%. As I mentioned, we can go even further down. So within La Guajira, I'll just unclick the department, and then I'll click just the department of Manaure, So remember, we're in La Guajira, municipality Manaure, and rurally dispersed. So the situation for Manaure, rurally dispersed, 5% of the population has sanitation coverage. But this means you already have a very focused scope for your program. You know, you're gonna be working with 16,000 households. You know, maybe it can be a 10-year, 5-year program, but at least you have a very target population that you're gonna be working with. So rurally dispersed population in the municipality of Manaure in La Guajira. And this is the purpose of this portal, initial page, so you can see where are the specific needs in the country at the municipal level, so you can target your programs in there.
I think we have 5 minutes, so maybe just show the, thank you. And I think that, yeah, the sanitation solutions and then the community view, and then see if there's any questions. Are we okay on time? We have 5 minutes? 4 minutes? Okay. So yeah.
Yeah, so once you have determined, okay, we're gonna work in Manaure, in the municipality of Manaure in La Guajira, there's gonna be this view that will show you like what programs are being implemented there. So far we have the example of Satoso, where you can see the map of the communities that are currently within the program with the different status, like if they're already certified, if they're in post-activation, they're pending, they're in the activation phase, how many communities have already been certified, and the community level information, like this is according to the program. So how many sanitation solutions have been built, how many hand washing solutions have been built, how many households still without a latrine, this is what you see here, and also how many children between 0 and 5 years old live in the communities ranked by the communities that have the most children between 0 and 5. So this is just a dashboard at the community level, and we can even go further. This is like, I guess this is program level, and then community level, we would have the opportunity to look at specific communities, like for example, this one. You would click on the community, and it would give you information. If you see this means that the program hasn't started there yet.
But yeah, bathrooms are in there, cupboards are in there, as you guys all mentioned. So
yeah, I guess any comments? We have 2 minutes left, so if anyone has a comment, feedback, anything you want to add, more than welcome. We have 2 minutes, so.
yes.
Let me put some general questions. The first one, this database is managed by UNICEF, IMF, or the municipality or the government authorities. And will other organization or other departments will have access to it or not to use it? And the second one is, for example, if a community is certified as ODF, in the upcoming years, what will be the monitoring mechanism so that the community stand on its status? Yeah.
Thank you.
The first one, do you want to show the manual, the uso that shows the databases?
Yeah, this portal, the upkeep of the databases is centralized by UNICEF. So all the national databases that feed the national level page are managed by, not managed by UNICEF, but centralized by UNICEF. So they would draw in the data and keep up the database, make sure it's updated and clean. The program level information would be fed by implementing partners in the field, but also be centralized by UNICEF, just to make sure that the dashboard is fed the data appropriately with the correct format, etc.
And the ODF is responsible, the program is responsible for
The program is
reporting that,
responsible,
yeah.
yeah.
So, yeah, that's the implementing partner that reports that it's ODF free also has to maintain that and will be asked, UNICEF monitors and follows up with that, with ODF status. So maybe 1 or 2 more questions.
No, my concern is UNICEF being the custodian of the data rather than the government, because the government will be there forever.
The government gives it to UNICEF.
Okay.
Yeah.
Yeah.
So there is that mushy relationship between the government and
Yeah, they function with, they have the WASH cluster, and then, yeah, UNICEF, or maybe you know more than that, but they
Yeah, I
report to
mean,
UNICEF, what I understand.
The national level data, as I mentioned, like coverage data, comes directly from a government agency. And UNICEF sort of like facilitates the role to have this dashboard live, and it's public for everyone to see, to go back to your question. But yeah, it's important that UNICEF has a strong relationship with the government, and that the dashboard is readily available for people to use. Yes.
Yes. Thank you for your presentation so far. I would have preferred to ask my question after you might have finished the presentation. But this one is coming because you have already mentioned something there that prompted me to ask my question. This is a research, right? And I've meant to know that you are still working on it. So what are the recommendations? Does it have recommendations for affected communities? What recommendations will you give to the affected communities there?
It's not for us to recommend. I don't think, as the ones that support the construction of the data portal, I think, yeah, it's for local entities to recommend how to use the decision-making tools to keep open defecation free status, or to achieve open defecation status.
Yeah.
So
We do recommend like the program implementators to be like in touch with the community and have constant data flowing in, and to make sure that there's good quality data. So depending on the roles and responsibilities, but yeah, we're more there to advise and be like, hey, we need good quality data, make sure you're getting the data from the data source, and that you're keeping it updated. So
yeah, we just want to make sure the data is accurate. Like our teammate here was saying, that the data is quality coming in, and then it should be, yeah, we're outsiders, so shouldn't be saying like what to do. But yeah, I mean, if you give recommendations based on.
That's great. My question has been answered.
Okay.
Thank you.
Thank you.
We're done?
Cool.
Thank you very much, guys.
Guys, thank you so much for joining. Yeah, we're here all week, so please come talk to us. And yeah, super grateful for your time. Thank you, guys.
Thank you very much.
Thank you.
Quick question. I'm Lola, nice to meet you with the Global Water Center. Something I'm so curious about is, not with this organization, but almost 9 years ago, I was with an organization, we were using Akvo flow.
Akvo flow,
Yeah, sorry.
What is it?
So I'm curious, like, you know, Akvo has clearly, like, had a big progression from, it seems like it really started with Latin. What's your decision making about yeah.
Okay, nice. Yeah. I'm in my MS.
You need to ask. I don't think I can help you with that. You need to ask the lady that was here.
Okay, nice.
Hey, how are you?
From Practical Action. Sorry, I actually
Okay,
the first
I
part,
actually
so I
step out.
couldn't engage that much. But in Bangladesh, we are working with government to develop
Yeah, exactly. We could use that at the time. Yeah.
only get the information of sanitation. So I think we are also working with UNICEF. UNICEF is now working with us in that model. But I think your work is more comprehensive because you have a national and data portal. I think it's very important.
So anyway,
Like you have done
that's why I'm so
UNICEF.
curious about this story.
Yes. UNICEF,
Yeah, there's free tools
funded
that are
the
Okay. And mainly the owner of the portal is government.
No, I mean, UNICEF, the end objective of UNICEF is to be able to sell it to the government.
Or sell it to
Yeah, but so far it's UNICEF's venture, like, so far. Yeah.
But I have to go, so I'm really sorry. I have to run to do that.
John is global, okay, in one district. So, it would be really, can we get this,
I like the way that you.
Yeah, of course.
like how paying is, what are the data?
And then you're from Liberia.
Oh, yeah.
From Liberia.
I have a card.
Liberia. You.
I'm from Nigeria.
Oh, Nigeria. Oh, I heard the accent. I thought it's from Liberia. We also work in
We are
Liberia.
working with one Indian organization, so actually they are supporting us to develop that database.
Nice. Yeah.
Thank you so much, appreciate it. Yes, Leah?
Yeah, I think the database portion could be more advanced. You know, you have SQL and all of that to manage the database a bit more seamlessly and like more automated. So far, what we put together, working with Power BI, what you do, you get an Excel sheet and you can connect the Excel sheet to Power BI directly, and whatever you update that Excel sheet, it's connected directly with Power BI and it will update the information. But for like census level data, you know, it's every 4 years, you don't need to update that often. So the national level data that we showed, this is static. So all you need is creating this dashboard that helps you interact with the different filters. And this you can access in Colombia, at least you can access freely from the National Department of Statistics. So
it is UNICEF Colombia.
UNICEF Colombia, yeah.
Oh, okay.
Yeah.
You are from UNICEF Colombia?
No,
You are from
I'm from
the
Akvo.
Oh, Agro, so then you are like, okay. Agro. Yes.
We're the data partner.
Oh, data partner, yes. So we have one data partner, they are based in India.
Nice. Yeah, I'm sure you have really good data organizations in India.
Yeah.
So,
But I like your
Also,
data.
sure, I mean, we're open to collaborate if you want. We're more than happy to support you.
Yeah.